Hello friends, welcome to this module on Hodgkin's lymphoma. So what actually is Hodgkin's lymphoma? This is basically a malignancy of B cells. This is basically a malignancy of B cells. If we talk about the distribution wise, then non-Hodgkin's lymphoma is much more common entity than Hodgkin's lymphoma. Non-Hodgkin's is much more common entity than a Hodgkin's lymphoma. And if you see that the Hodgkin's lymphoma, they have got a bimodal age distribution. They've got a bimodal age distribution. You can see a spike in the 20 years of age, and you can see another spike at the 80 years of age. So how do we classify the Hodgkin's lymphoma? The Hodgkin's lymphoma is basically classified into two broad categories. One is the classical one, and the other is the nodular lymphocyte predominant Hodgkin's lymphoma. This is basically considered as a separate entity from Hodgkin's lymphoma. Why? We'll come to that. And what are the different variants of classical Hodgkin's lymphoma? Number one, mixed cellularity. Number two, lymphocyte rich. Number three, lymphocyte depleted. And the fourth variant is the nodular sclerosis. Nodular sclerosis. Now, mixed cellularity is basically the most common type of Hodgkin's lymphoma in our country, in elderly group, in HIV, and in the developing nations. Whereas nodular sclerosis is the most common type of Hodgkin lymphoma in young patients and in developed countries. Coming to the risk factors, there are two important viral risk factors which increase the risk of Hodgkin's lymphoma. What are they? Number one is HIV and number two is EBV. The risk of EBV causing Hodgkin's lymphoma in presence of HIV is approximately 100%. And in non-HIV it is 1/3. That is approximately, it comes to mathematically 33%. So you can see EBV with HIV, this dual infection is a very high risk factor for the development of Hodgkin's lymphoma. Now guys, what you need to know is that in Hodgkin's lymphoma we have a presence of classical cell which is known as the Reed-Sternberg cells, So they are known as the Hodgkin Reed-Sternberg cells, or the HRS cells, which you see in the histology examination. So if you look at the image, how does a classical HRS looks like? Well, it basically has a bilobed nuclei. And if you look into this diagram, you can see that there is a bilobed nuclei in the center with a background of so many inflammatory cells. And there are particular CD markers which are very classical of Reed-Sternberg cells. What are those markers? It is CD15 positive, CD30 positive, and CD19 and CD20 negative. So it is CD15 and 30 positive, whereas 19 and 20 are negative. This you have to remember because you will be given a clinical scenario in your exam and you can be asked about these CD markers. So 15 and 30 you have to remember. This is the CD marker of a Reed-Sternberg cells. Now, how does the Hodgkin lymphoma presents? You have to remember that these patients present with a painless enlargement of lymph nodes. So you have a painless progressive enlargement of lymph nodes. And where are the lymph nodes more commonly enlarged? The most common site is neck.